Ms. Kuchai, what is chronic cough and how do you manage that?
Sure. Cough is a very common symptom. Most of us suffer with it at some point in our lives, but very occasionally it can last longer than a month. Typically, a chronic cough is a cough that lasts for longer than 6 weeks and can be troublesome. It doesn't always mean that it is what we call productive. That means that you bring up something with it, phlegm, etc. It could just be irritative, but it has a wide range of causes and tends to often flummox the clinician seeing the patient, knowing where to start, and the symptoms themselves could be widespread and not just causally by one particular field.
Mm-hmm. So is it something to worry about? When do you say, I need to see a doctor?
I think if the symptoms happen on a daily basis and are not answerable to anything obvious that the patient can feel, I would say I would seek attention from a doctor first. That could be your GP. They're very happy to look at all the systems that are relevant. The areas that we do commonly think that might be the problem could be your chest. This is one of the most common areas that patients are referred to the specialist for. If the doctor feels that it is unlikely to be the chest, they may be referred to the ENT surgeon. And that's looking at things like catarrh, nasal congestion, sinuses, and also just inflammation of the larynx for a variety of different reasons.
Mm-hmm. So you do intervene at that level, so you would be one of the first port of calls for chronic cough.
Absolutely. Often the patient will give the story, so they will say, actually I'm not short of breath, I don't have a wheeze, I don't find it difficult to breathe, but I do feel that I have a lot of congestion in my nose, I have a lot of catarrh, and I feel blocked. Or they may even just complain of frequency of loss of voice, change in their voice, quality of voice, etc. So we look at the top end, as I call it, from the airway perspective and work our way downwards. And the beauty of seeing an ENT specialist is often that we can use an endoscope. So we can actually assess the throat and the nose clinically in the outpatient setting, which is often quite reassuring for the patient as well, because they get a visualization of it. So the most important thing that most patients beyond the age of 40 are looking for is to just say that it isn't a cancer. And it's putting their mind at rest in clinic is a big relief.
Mm-hmm. And then what type of treatments is there if you do suffer from chronic cough?
It really depends on the cause. Yeah, it depends on the cause. So if I think that it is to do with the nose and the sinuses and catarrh is falling chronically over the larynx, the patients won't always pick this up, but when you mention it to them, they suddenly, a light bulb moment happens and they say, actually, I've realised I've had this for some years. And then at that stage, I would often start with a nasal decongestant, sometimes even doing allergy tests. But if it looks unlikely to be the nose and the sinuses, I'll then look further down, and if the larynx itself appears absolutely normal, I start looking slightly further along the pathway, which could be stomach with reflux issues, silent reflux, and even the chest with regards to asthma, etc. So we work in multidisciplinary teams and we work with allied specialities that therefore can help with further diagnostics down the road.
So the advice is get it checked.
Absolutely.
It might not be very bad, but you have to get it checked.
Even if it's not severe, if it's lasted longer than a month, it's worth going to see your doctor and then a specialist.
And it doesn't usually resolve itself. You need to identify where it's
Exactly. In some cases, it is the case that we can't identify the exact cause. And we've done extensive tests. And sometimes we find it is something like hypersensitivity of the larynx, which is started from an infection several months ago. And that will just simply take homeopathic therapies, drinking warm water, all the natural remedies and time.
Thank you very much.
Thank you.